Hey everyone, Peter here with another episode of Keeping Up with the Grandkids. Today I want to talk about bone density. I had a discussion with one of my patients the other day. The discussion about medication led to, I was diagnosed with osteoporosis and I'm taking medications because of that. We got to talking further. Our bones are in a constant state of metabolism, bone formation, which adds to your bone mass, bone resorption, which decreases it. That process is constantly adjusting to our daily life and loads that we put our skeletal system through. In a healthy individual, that scale is pretty balanced. Osteoporosis is essentially, this has happened where their resorption is higher than their formation. In order to manage this, we have to tip the scales back in your favor. How do we do that? It's typically a three-pronged approach. Medications can have an effect on the resorption rate and potentially bring it down. Nutritional supplementation with things like calcium, vitamin D, add to the available building blocks to form bone, but also there needs to be a pretty critical third prong, some kind of physical stimulus to stimulate the bone formation side, the osteoblast cells. They need some sort of signal to create that bone. Someone would be doing themselves a disservice if they didn't get that physical component. This was the situation with this individual, which kind of ticked me off because they had given her some medication. She's taking calcium and vitamin D and all those supplements, but no one had ever talked to her about how exercise and loading is kind of critical in this process. I had that discussion with her the other day and she was very thankful for it. I wanted to use that opportunity to educate some more people about how aging affects bone loss, what we've learned about it through things like space flight, bed rest, spinal cord injuries, and I want to talk about how you might approach things from a physical standpoint and movement and exercise standpoint in terms of managing something like this. I'm going to take you guys to the whiteboard so we can get some visuals on what's going on here. I've highlighted a few things. These purple outlines of the bone indicate the cortical or outer layer of a bone that is more dense and rigid. These blue lines indicate the trabecular bone. The trabecular bone has that more architectural type of quality to it, and what that does is save weight, still provides that support that we need to have that structural integrity in the skeleton, and allows us to move more freely. With osteoporosis, the resorption or the bone breakdown rate really gets beefed up. It's also possible for the bone formation rate to drop. When you have this situation is when you end up with osteoporosis. So what frustrated me about the discussion that I had with one of my patients earlier this week is that there were measures to add to the potential building block of the bone by getting her more calcium, vitamin D, medications to potentially arrest or decrease the rate of resorption, but there was nothing done about the formation rate. Without that physical loading component, there's probably not going to be much done to beef these bones up. Let's say these are osteoporotic bones. What loading is going to do is over time start beefing everything up. Having that physical stimulus increases the rate of formation, and that's why it's so important. The other stuff is important for resorption because the physical loading doesn't necessarily stop or slow this down, but even in healthy individuals, there's a balance between the two. Someone in a situation that they have osteoporosis, it's very important to address that other side of the scale, have that physical loading to make sure that they're getting the formation, because the other stuff is only aimed at this. That's why it's a multi-tier, that kind of three-pronged approach that's important, that all pieces need to be there to be the most effective. Now we get onto the topic of how do we load? What kind of countermeasures can be taken to recover bone mass and density as well as the muscles? So we know that exercise has to be intense. If it's below a certain threshold, it might be good enough to maintain, but we know it has to cross a certain threshold in order to build and add to the bone density. What are the best ways to do that? We know from studies on space travel, bed rest, people with spinal cord injuries, there are two critical types of forces that we can impart on the body to have a positive effect on bone density, and that's the external load or the gravitational load. Number two, heavy resistance exercise. The internal forces that we generate with our muscles also have a beneficial effect on our bone density. keep in mind for the elderly, maybe you have a history of fractures in that type of setting are going to be done more gradually, but we know that there's probably a certain threshold that you're going to have to cross in order to get the desired effect that you want. Otherwise, you're probably just going to maintain, which isn't a bad thing, but if you really want to increase the bone density and get out of that osteoporosis, osteopenia zone, you're going to have to train somewhat intensely in order to stimulate those adaptations. Osteoporosis isn't something that develops overnight, and we know from the space travel studies that for the amount of time that you spend losing that bone, it's probably going to take even longer to recover it. Let's use an example. Let's say an astronaut is up in space for 30 days. Once they return to Earth, they could probably expect like 90 to 120, so like 3 to 4 months, doing regular training and taking measures to increase their bone density once they're back on Earth until they're kind of back to normal. Why is that important for an elderly individual? Don't expect this to change overnight. This is going to be a long process. In a recent study, they followed individuals in 2 different groups for 10 months. This is a long process. It has to be done gradually, cautiously, but at the same time, intense enough to stimulate a change for someone that has osteoporosis, is at risk at fracture, may have a history of fractures already. If you're consistent with it, if you progress things gradually, you're going to get the benefits that you want. And if you're not sure where to get started, if you don't feel safe, if you're worried about falling, if you have a history of fractures, talk to a physical therapist. They will be able to help you. I'd be happy to help you if you guys have any questions. I hope you found that interesting. Thought it was important to share because for some reason either that patient forgot the conversation or someone never had it with them about the critical component of that physical loading, that it really is a very important of that full approach to battling osteoporosis. Thank you for watching. Take care until next time.